With your host, Dr. Jeffrey Dash. We're leading a discussion now about the low testosterone condition in men. There are about 13 million men in the United States who have low testosterone levels with typical symptoms of decreased libido, erectile dysfunction, reduced energy, reduced strength and stamina, reduced athletic performance, insomnia, sleep problems, mood disorders, depression, muscle mass, loss of muscle mass, cognitive dysfunction, etc., dry eyes, dry skin. What are the causes of low testosterone, and how do we recognize, and how do we, what are some of the things that we should be looking for in terms of causation? Number one, aging. As we get older, testosterone levels decline with age, so that over the age of 50, we would expect to find more men with lower testosterone levels. Various toxins, for example, chemotherapy or radiation therapy for cancer, will produce a low testosterone condition because of damage to the organ that makes testosterone, which is the testicle. The testicle in the male is the organ which produces testosterone. Infection, for example, mumps orchitis is an infection of the testicle, and if it happens in adulthood, that can lead to low testosterone production from testicular damage. So any trauma, injury, testicular injury can also produce low testosterone. Hemochromatosis is a genetic syndrome in which there's accumulation of iron. It's a genetic inability to eliminate iron from the body. We need iron, of course, in our diet to make red blood cells, and hemoglobin has iron, an iron molecule in the center of the hemoglobin molecule, so we need iron to make blood. Men who with hemochromatosis gene, there's a gene test for it, will accumulate iron, can't get rid of it. We just these people will have very high iron and ferritin levels. Ferritin is an iron marker. Iron in these people tends to accumulate in various organ systems, such as the testicle, which will produce low testosterone production. Other causes of low testosterone, head trauma is a very large one, very large prevalent cause of low testosterone. How does head trauma cause low testosterone? Well, head trauma can damage the pituitary gland, which is on a little delicate stalk at the base of the brain. The pituitary gland sits in a little indentation in the base of the skull called the sella turcica, and it's very easily damaged by head trauma. The pituitary makes the two hormones LH and FSH. LH is responsible for testosterone production. LH is the hormone which then travels from the pituitary to the testicle and stimulates testicular production of testosterone. The other hormone, FSH, the other pituitary hormone, FSH, is responsible for testicular production of sperm. If there's pituitary damage from trauma, or even perhaps to pituitary tumor or a brain tumor which is pushing on the pituitary, these can produce a low testosterone type of condition. Young men who abuse steroids, they buy testosterone on the internet, synthetic testosterone perhaps, and use it for bodybuilding. This will disturb their hypothalamic pituitary axis, and they may have irreversible loss of testosterone production for many years after that. So testosterone abuse, synthetic testosterone abuse by bodybuilders is a very bad thing, and we want to avoid that. When we talk about testosterone replacement, we're essentially talking about elderly men over the age of 50. We want to avoid giving testosterone supplementation to younger men, because remember, testosterone will produce, if testosterone taken exogenously, meaning taken as an injection or as a topical cream and given to men, will suppress endogenous testosterone production, meaning this will suppress our own production by the testicle. And all of the endocrine organs work that way. If we give the particular hormone, the endocrine end organ will then stop production because of the feedback mechanism. Same thing for testosterone. Young men who abuse testosterone will have severe adverse side effects from testosterone suppression for many years after that. And this is a bad thing and something we want to avoid and caution young men not to do that. Narcotics, opiates, this is another class of drugs which causes severe testosterone suppression. And not only testosterone suppression, but also the entire hormonal system of the body is suppressed by opiates. This is a very bad thing. It's a very bad adverse side effect of chronic opiate use, and it's one of the reasons why long-term pain pill usage for a chronic pain condition is not a good idea, because it produces profound suppression of the endocrine system, including very low testosterone levels. This type of profound suppression is not compatible with good health. Another condition, obesity and diabetes, being overweight, having a high blood sugar, these types of things are associated with low testosterone condition and do respond nicely to testosterone supplementation. What types of laboratory testing? Now that we know what the symptoms are and what are the causes of low testosterone, what types of laboratory testing can we do to determine what's going on? And the types of testing that we use in our office, number one, we want to test for testosterone using the correct total and free testosterone test. If you look in the catalog for the lab, there's about a dozen different testing techniques for testosterone. The best one, of course, is the high-pressure liquid chromatography mass spectroscopy, and that's the one we use along with the free testosterone. We also include a measurement of LH, FSH, estradiol, and PSA. That should be included routinely. And in addition to that, we have a very extensive laboratory testing panel. We look at a lot of other things. We mentioned hemochromatosis is one of the causes of low testosterone, so it's very important to include iron and ferritin in the panel. That's the test for hemochromatosis. If a man over the age of 50 has hemochromatosis, and that's causing their low testosterone, and that's not tested for and missed, and then they can actually be made worse by giving them testosterone. So that has to be detected and treated properly before testosterone can be given. We also routinely check thyroid panel, cortisol, selenium. We also look at iodine levels. The World Health Organization has determined about 15% of the United States population is iodine deficient, so we use the same testing for iodine as the World Health Organization, which is the spot urinary iodine level. Easy to do, although all the top labs will perform that test no problem. We also look at vitamin C levels, we look at vitamin B12 levels, we look at the new upgraded, more sophisticated cholesterol panel called the VAP, and of course the blood count, the chemistry panel. We also look at CRP, which is an inflammatory marker, hemoglobin A1C, and fasting blood sugars are the diabetic markers. And this should be routine. If your doctor isn't testing for these things, then you need a new doctor. Okay, in terms of testing panel, what we do is we then have you come back, review all of your labs, and get you started on treatment. What kind of treatment is the, what are the components, what are the ingredients of a good treatment program? Well, testosterone is the human bioidentical hormone. It's a human bioidentical hormone which is available now as an FDA-approved drug at the local drugstore. CVS, Walgreens, Publix, Target, you name it. Any kind of drugstore is going to have FDA-approved testosterone as a topical gel, and it's called Androgel. There's two of them, Androgel. The other one is Testem, and they come in little packets, and they can be prescribed by pretty much any physician. The doctors doing most of the prescriptions for Androgel and Testem are the urologists. The urologists are the kidney, prostate doctors. They are the ones who deal with that particular organ system in the body. And they've jumped onto the bandwagon in a big way. The urologists are now prescribing testosterone freely to males with low testosterone. If that is true, then why is it that 90% of the 13 million men with low testosterone are still not being treated? It's a good question, and I would suggest to you that you know, there is probably only a small percentage of urologists that